Welcome back to the Deep Dive. We've got a really interesting question from a listener today about local anesthesia
Oh, yeah.
and asthma.
Sounds like a good one.
Yeah, they're asking specifically about, can people with asthma safely get local anesthesia that contains adrenaline?
It's a great question, and it's one that we actually get pretty often.
Yeah.
A lot of folks are understandably a little concerned about, anything that might affect their breathing.
Right, exactly.
Yeah.
So I guess to just kind of cut to the chase here,
Sure.
is it safe or not?
Well, the short answer is yes. In
Yeah.
most cases, local anesthetics with adrenaline can be used safely for patients with asthma.
Okay.
But of course,
It's
there's
always a but. Right.
right. There's a little more nuance to it than that.
Yeah.
We got to dive a little deeper to really understand the why and the how.
Okay, yeah, because, adrenaline, we all know it as this, fight or flight hormone. It gets your heart racing. It affects your breathing.
Exactly. Epinephrine, it's a powerful substance
Yeah.
for sure.
So how does that all play into, a tiny injection at the dentist's office?
Well, the key here is dosage and location.
Okay.
When we use adrenaline in local anesthesia, we're talking about very, very small amounts.
Okay,
And it's injected directly into a very specific spot.
gotcha.
So it causes localized vasoconstriction, meaning it constricts the blood vessels right there in that tiny area.
And that's what helps the numbing effect last longer.
Exactly. It keeps the anesthetic from spreading too quickly and wearing off too soon.
Clever. So because it's such a small amount and it's so targeted, it doesn't really have a chance to impact the airways in a significant way.
Right. The risk of it triggering an asthma attack is incredibly low.
Okay, that's reassuring to hear. But I'm curious, if the amount of adrenaline is so small, why even include it at all?
Great question. So remember we talked about those sodium channels, the ones that local anesthetics block to stop the pain signal?
Yeah, like little gates on the nerves, right?
Exactly. Now, those channels are all over the body, not just in the area we're trying to numb.
Oh, so if the anesthetic spreads too far, you could end up numbing things you don't want numb.
You got it. And in some cases, it could even enter the bloodstream and have more widespread effects.
Oh, I see.
That's where the adrenaline comes in handy.
Oh.
By constricting those blood vessels at the injection site, it basically keeps the anesthetic contained.
So it acts like a little fence.
Exactly. Keeping the anesthetic working right where we need it.
Okay, so it sounds like adrenaline is pulling double duty here, helping the numbness last longer and also preventing the anesthetic from going rogue.
You got it. It's all about maximizing effectiveness and safety.
Smart. But, even with those precautions, I'm sure some people with asthma might still feel a little hesitant about getting local anesthesia with adrenaline. What would you say to someone who's feeling anxious about that?
I'd say, first and foremost, talk to your dentist. Open communication is key. Make
Yeah.
sure they know about your asthma history, how severe it is, any medications you're taking.
Right, because everyone's different and there might be some specific things to consider.
Exactly. And dentists are trained to assess individual needs and adjust treatment plans accordingly. They might consider using a different type of anesthetic or adjusting the dosage or even exploring other pain management options.
Okay, so we've covered the why of using adrenaline in local anesthesia and how that tiny targeted dose really minimizes the risk for most people with asthma.
And we've emphasized the importance of talking to your dentist and making sure they have all the information they need to provide the best possible care.
So where do we go from here? What other key points should we dive into to help our listener really understand the science behind this whole adrenaline asthma connection?
Well, to really get this, we need to zoom in a bit
Okay.
and see how local anesthetics actually work on like a cellular level. It's actually pretty fascinating.
Yeah, always love learning about the nitty-gritty details.
All right, so imagine your nerves are like electrical wires, carrying those pain signals.
Okay, I can picture that.
And along those wires, there are these tiny little gateways called sodium channels. They're embedded in the nerve membrane. Now, local anesthetics basically jam those gates.
So the pain signal can't get through.
Exactly. It's like putting up a roadblock on the pain highway.
Love it.
Yeah.
So how does the anesthetic actually reach those gates?
Well, that's where the journey gets interesting.
Okay.
It starts with the injection, right? The local anesthetic solution kind of diffuses through the tissue, heading towards those nerve cells.
Okay.
But here's the thing. The solution itself is often a bit acidic.
Acidic. Ouch. That doesn't sound too pleasant.
Yeah, it can be a little harsh. That's why dentists often add a buffering agent to the solution.
Oh, okay. So to kind of neutralize the acidity.
Exactly. It's like adding a little baking soda to lemon juice makes the whole experience a lot more comfortable.
That makes sense. So once the anesthetic is in there and it's, less acidic, What happens next?
Well, those little anesthetic molecules, they keep moving, right? They eventually reach the nerve membrane where those sodium channels are hanging out. But here's the catch. Not all anesthetic molecules can just waltz right in and bind to those
Oh,
channels.
really?
It all comes down to their chemical structure and the environment around them.
So, like, some anesthetics are better at getting to their target than others.
Precisely. Factors like the type of anesthetic, whether it's an ester or an amide, and the pH of the surrounding tissue can all influence how well those anesthetic molecules can actually get in there and do their job.
Okay, so we've got the type of anesthetic, the pH, the adrenaline. It's like a whole orchestra of factors working together.
Exactly. And this is where things get even more interesting when we're talking about asthma.
Okay, how so?
Well, remember how we talked about inflammation being a big part of asthma?
Yeah, those airways get all inflamed and irritated.
Right. And inflamed tissues tend to be more acidic.
Oh,
And that acidic environment can actually make it harder for some local anesthetics to work effectively. It's like trying to swim upstream. The anesthetic molecules have to work a lot harder to reach their target.
wow. So even if the anesthetic isn't directly affecting the airways, the inflammation from asthma could still play a role.
Exactly. That's why it's so crucial for dentists to have a really good understanding of their patient's overall health, especially when it comes to conditions like asthma.
Makes sense.
Huh?
It's all about that personalized approach, right?
Absolutely.
Yeah.
Knowing the science and understanding each person's unique situation.
So speaking of personalized approaches,
Yeah.
let's talk a bit more about the role of adrenaline in managing potential risks.
Okay.
We already touched on how it helps prolong numbness and keep the anesthetic localized.
Right, like building that little chemical fence.
Exactly. But are there any other safety aspects, especially when it comes to asthma?
Well, yeah, there's another layer to consider. You see, if a local anesthetic does manage to get into the bloodstream in larger amounts,
Uh-huh.
it could potentially trigger what we call systemic effects. Things like affecting the cardiovascular system or even the respiratory system in some cases.
Right.
So adrenaline, it actually helps to minimize that risk.
By keeping the anesthetic contained.
You got it. It's like adding an extra layer of protection.
Okay, so just to recap, we've learned that local anesthetics work by blocking those sodium channels on nerve cells, which stops those pain signals from reaching the brain.
Right.
We've also talked about how things like pH and inflammation can affect how well the anesthetic actually gets to its target and does its job.
And we've dug into the role of adrenaline.
Yes, the
Yeah.
adrenaline. It not only helps the numbness last longer and stay put, but it also minimizes the risk of those unwanted systemic effects.
Exactly, which is particularly important for folks with asthma.
Absolutely. Now, I'm sure our listeners are wondering, are there ever any situations where using a local anesthetic with adrenaline might be a little riskier for someone with asthma?
That's where, that personalized approach we keep talking about, that's really where it comes in.
Right, because it's not one size fits all.
Exactly. While that small dose of adrenaline and local anesthesia is generally safe for most people with asthma, there are a few situations where, a little extra caution might be needed.
Okay, I'm listening. What kind of situations are we talking about?
First off, the severity of someone's asthma plays a big role. If you have mild, well-controlled asthma, the risk is probably pretty tiny.
Okay.
But if you have more severe asthma or a history of, serious attacks, then your dentist might want to consider a more conservative approach.
So it's like a spectrum of risk almost.
Yeah, that's a good way to think about it. Another thing to keep in mind is the type of asthma medication you're currently taking.
Okay.
Some medications, like those long-acting beta agonists, they can actually make the airways a bit more sensitive to adrenaline.
Oh, so even that tiny amount in the anesthetic might have a more noticeable effect.
Exactly. Your dentist definitely needs to know about those meds so they can make the best call for your specific situation.
Gotcha. So they might choose a different anesthetic altogether or
Yeah.
adjust the dosage.
Precisely. It's all about minimizing any potential risk.
It really highlights how important it is to be totally upfront with your dentist about your asthma and any medications you're on.
Absolutely. Don't be shy about sharing all the details. It's a team effort.
Right. The more they know, the better they can help.
Exactly. So we've talked about potential risks, but is there a flip side to this? Could there actually be any benefits to using a local anesthetic with adrenaline for someone with asthma?
Oh, that's an interesting thought. I hadn't considered that.
Yeah, it turns out there might be a silver lining to this whole adrenaline thing.
Okay. I'm intrigued. Tell me more.
Well, some research suggests that that tiny bit of adrenaline in local anesthesia might actually have a slight bronchodilating effect.
Wait, so it might actually make it easier to breathe?
That's what some studies are hinting at. Seems counterintuitive, right? But remember, adrenaline's got that dual nature. We talked about how it can constrict blood vessels,
Hmm.
but it can also relax airways in small doses, especially when it's not directly targeting the lungs.
Wow, that's wild. So instead of worrying about an asthma attack, some people might actually experience like a little boost to their breathing.
It's a possibility. Of course, more research is needed to really confirm this, but it's definitely an area worth exploring.
This deep dive has been full of surprises. We've learned that local anesthetics with adrenaline can generally be used safely for folks with asthma.
Right. And that tiny targeted dose really minimizes the risk for most people.
But we've also learned about the importance of that personalized approach. Open communication with your dentist and really understanding those individual factors like asthma severity and current medications.
And who knew that adrenaline might even have a secret superpower up its sleeve?
The human body is a mysterious and wonderful thing.
It really is. And that's what makes exploring these topics so fascinating.
Well said. It's like peeling back the layers of an onion. Always something new to discover.
Exactly. And that's what we're all about here on the Deep Dive, helping you uncover those hidden connections, challenge assumptions, and gain a deeper understanding of the world around us.
So keep those questions coming, deep divers. We're always ready for a new adventure. Until next time, happy diving.